fact that you have waning immunity isn't enough of a reason to, justify a public health recommendation at this point.
At 6, local health professionals and infectious disease experts say a booster shot is not yet needed. At least the science doesn't suggest it yet. Good evening. Thanks for joining us for Crown 4 News at 6. I'm Ken Wayne.
And I'm Catherine Heenan in for Pam Moore tonight. A new study shows that Pfizer's 2-dose COVID vaccine does remain effective after 6 months, but not as strongly as first thought. Now, Pfizer is again recommending a booster shot.
However, medical experts say that at this point, studies do not indicate the booster is needed. Ground Force Dan Kerman live for us at UCSF with more. Dan.
Well, officials say what would indicate that a booster is needed is if those breakthrough infections of those who are vaccinated are sending those folks to the hospital or those folks are dying. They say that is not what's happening, and that is why a booster still is not suggested. A new study finds the effectiveness of Pfizer's 2-shot COVID-19 vaccine diminishes over time. The study conducted prior to the emergence of the Delta variant finds what initially was 96% protection from infection drops to about 84% after 6 months. However, the 2-dose vaccine remains nearly 97% effective against severe disease. And that's why federal and local infectious disease experts say this unpublished and unreviewed study simply doesn't support a booster shot.
If you want to take away from the study that we may need boosters based upon the data they had, I don't think you can quite conclude that.
At the end of the day, we're still not seeing hospitalizations in large numbers, certainly not deaths in people who are vaccinated.
In a separate, smaller study, Pfizer found giving a 3rd dose of the vaccine after 6 months increases antibody levels against the Delta variant.
It's exactly what you would expect with any vaccine. If you get a booster shot, that's why we give boosters. It boosts your antibody level.
And while expected, medical experts say that alone is not a reason to recommend a booster either.
Doesn't tell me if it prevents you from getting infected again with Delta or another variant or Lambda or anything. It just tells me that the number of antibodies increases after you get a booster shot.
Infectious disease experts say the focus now should be on getting shots to the unvaccinated to stop the spread of the virus before a new variant worse than Delta emerges.
The more disease you have being spread or infection being transmitted, you're going to have an increased probability of getting variants. And the more people are unvaccinated, who are the reservoirs of these viruses being transmitted, the more chances you have to create these super variants of the future.
And infectious disease experts say if these new variants down the line prove to be more effective against the vaccine, that will not lead to the need for a booster. It will lead to the need for a new vaccine. Live at UCSF, Dan Kerman, Crown 4 News.
Thank you for that. Meantime,